You're listening to the All Things ADHD podcast. Hey, thanks for joining. I'm your host, Melvin Bogard. Today's show will focus on the challenges of ADHD diagnosing and treatment and overcoming barriers in the Black community. My guest today is psychologist and author, Dr. Nekeshia Hammond. Welcome, Dr. Hammond. Please tell me more about you and your work.
Sure. Dr. Nekeshia Hammond, as you said, I'm an author, a speaker, and a psychologist. I have been now in private practice for 12 years. One of my subspecialties is ADHD evaluations with youth, also adults, but mostly youth. And I'm really honored to be in the community as well, as a board member of the Ryan Neese Foundation and a board member of Rising Media Stars and a lot of other community endeavors.
Well, let's get started. Do you have some thoughts about why recent studies are finding that more African Americans are diagnosed with ADHD? Could it be that past diagnostic tools were not culturally sensitive enough to detect signs and symptoms in some racial ethnic groups?
Yeah, that's definitely a part of it. It's a very complex issue that has a lot of factors, to your point, connected with it. Some of the things being that even geographically, where children are located, Black children in particular, or Black and brown children are located, what type of community they're in, what type of resources they have, what does ADHD mean in that community? Because across even the US, I can go international too, but let's stick with the US. Across the US, ADHD has different meanings depending on what community. For some communities, actually, and this was, I don't remember what news network it came out on the news, people were paying professionals to get a diagnosis of ADHD. These were college age students to get accommodations or to get medication and that sort of thing. Right. So it was considered almost like a luxury diagnosis. And in other communities, it's considered like a sin and it's horrible and it's this vicious, horrible thing. So because of that, there's still not a lot of clarity right now, and the research is still very mixed on that issue, particularly with Black and brown communities. But I definitely would say it depends on what ADHD means in that community. Does it mean now you can get help? Or does it mean, oh no, now you're going to be labeled and there's a stereotype and you're going to be treated differently. And now you're in special education and the list goes on, right? So that's why you really start to see a lot of the disparities. I mean, we can go on and on. There's a lot of different factors and also a lot of biases that come about, particularly with Black and brown children, sometimes quickly labeling something that's not even that. It could be that they're just dealing with an issue in their life and they can't concentrate, but now they've been misdiagnosed with ADHD.
What would you say to Black parents overcoming ADHD stigma, diagnosing, which you sort of touched on, and if medically advised, starting their child on medication?
I would definitely say to start this process early. When I say this process, meaning starting with a thorough evaluation. I am not at all a fan of someone sitting down with your child for 5 minutes and immediately saying they have ADHD when they've talked to you for 5 minutes. I know it happens all over the world. I'm not a fan of it at all. You just can't know everything you want to know in 5 or 10 minutes. Second thing is that it's really, really important to make sure that you get a comprehensive psychological evaluation. There's neuropsychological evaluations. There's a lot of different evaluations, but the point is it should not be something that takes 5 or 10 minutes. And really thinking about what treatment might mean for your child, meaning if the person recommends therapy, let's say, I know it can be hard. I know that there's a stigma. I know that there's a lot of myths about what therapy means, but understanding that your child does not have to suffer unnecessarily. I can't even tell you how many teens, 11th graders, 12th graders that I've seen, and it's heartbreaking. The stories when I'm like, if you only had this evaluation 10 years ago, the heartache, pain, struggles through school, suspensions, just headache could have been prevented. So I love when people come into my office and they're in elementary school, let's say, or even preschool, because it's a whole new world when you get the proper diagnosis, first of all. Then from there, you get the proper treatment, which may or may not include medication, and you save yourself and your family a lot of heartache and pain unnecessarily when you take those steps. So I highly recommend start early. Do not wait. Do not wait. I also want people to understand that there are some children that get psychological evaluations and the results are they're fine. Like they're okay. They're having a normal reaction to, whatever's happening in their world. Like that happens too. So it's not always you come out on the other side and you have depression, anxiety, and ADHD and all these other things. Sometimes, yes, but you would want, just as how you'd get as an adult blood work done. And someone says, you're fine. There's nothing wrong with any part of you. You are healthy. All your blood work is great. It's basically the same thing with a psychological evaluation. You look at a lot of different parts. You say, okay, they don't have this, or this, but this is what's happening with them.
Research also showed that African Americans aren't as likely to receive treatment after being diagnosed, even though many studies show that it can drastically help kids and adults manage symptoms. Why is this happening, and what needs to be done to fix the problem?
It's really unfortunate. It's a major issue. One of the things being the stigma of mental health. A couple years ago, when I was president of the Florida Psychological Association and had an opportunity to travel throughout the country, I heard just from different people. And basically there was this false idea of what mental health treatment means, that you're weak, that you're not smart, that maybe it's mixing and you're not supposed to, quote unquote, go to therapy and also go to church. And there's all these myths about mental health and mental health treatment, which unfortunately really, really affects the Black and Brown communities. What I think needs to be done is there's a massive need for education about what it means. For myself, I host something called Mental Health Moment and online, and I've had a lot of discussion about what mental health means, especially for Black and Brown communities, that you can go to church, for example, and still receive treatment. Because that's a big issue. And really, there's this fear from a lot of parents that what does that mean if I start to get, again, the label, quote unquote, of ADHD for my child? Now, not only are they Black or a brown child in school and having to deal with racism, discrimination, and prejudice, which we know exists, but now there's another issue that they're afraid of teachers or administration labeling them and having different stereotypes about them. It's a very deep issue and complex issue, but I definitely think there's hope with more education surrounding this stigma and really trying to lessen the stigma so that, to your point, people can get the help they need, because the outcomes do show with the treatment and with the help, kids can get better.
We know there is a long road to overcoming implicit racial biases in America and the world. We know correcting the disparities will require schools, doctors, and communities to work together. What would you say to each of these groups to get us started on a path of seeing people beyond race, ethnicity, and gender?
Yeah, I love that question. A couple things. First of all, we know and what we do are two different things sometimes, right? But we know as a community, we have to collaborate in order to better the lives of youth. Like, we know that. Now, how that manifests is a different story. I'm a huge advocate also for social media and connecting in that way as professionals. I think that there's so much good information that others are sharing. Are you also collaborating with those individuals? Not just if you work at a school, not just the people you work with at a school, but the physicians that you know, the psychologists that you know, maybe it's a place of worship, people there that you know, as a community, the nonprofit organizations that want to help the schools and want to help kids with ADHD. Are we all taking the time to, even as social media, starting there, sharing that information, connecting with each other as professionals? You can go legislatively, you can advocate on that level. I'm proud to have been in Washington, D.C. several times, advocating at the federal level for patients with mental health issues, as well as in Florida, our state capital. So, I mean, there's so many things that you can be doing. It takes a village, and it really takes for us to have this collaborative mindset if we're really going to help youth. So I just want to encourage people to have hope, share information, positive, reputable information about ADHD, and don't be afraid to get the help that you need.
Thank you so much.
Thank you.
Thank you for listening to another episode of All Things ADHD.